like the best physician. And when it comes to information, he is loaded with it. I've known Dr. Holloway for so many years. We met initially at the Medicaid agency, and we saw him so much we thought he was the commissioner. He should have been. But he is always a wealth of information. He's with Payne and Holloway Pediatrics, 3 locations, 1 near you. So if you have any smaller children, please see Dr. A.Z. Holloway. He will take care of them. When I tell you he takes care of his babies, he does. So we are grateful to have him here. He is the guru of all things COVID related and the vaccine. So any questions you have, any concerns, he's the man. So without further ado, we'll bring up Dr. Holloway. Thank you, Dr. Holloway.
How did you follow a question like that? We even got some nuns by nuns, so I'm not in any frat.
We'll take it, Captain. When you can come now, we got you.
If I did, my daddy would have a heart attack. He's 93 years old, but he's an alpha.
Oh.
Okay, so and when I went to college, we didn't have his black friends, so that's how that happened. Well, I have 1 location of Payne and Holloway, and that's a general pediatric practice. My day job, as I was talking with the counselor back, is I work full-time in Montgomery Mental Health doing medication management for mental health patients. So those are the 2 things that I do most of the time now. I've been instructed to talk a little bit about COVID, talk a little bit about the Delta variant, and everybody is experts already. I don't know what I can tell you that you don't know. We already know the Delta variant is about 2.5 times more infectious than the previous variant. At least 90% of the tests that we do here in Alabama are still Delta. We don't know what the new strain is new. We don't know. We haven't started picking that up yet here in Alabama. We know that probably if you're unimmunized, you're probably 11 times more likely to end up hospitalized, and probably about 29% more likely to die if you're unimmunized and get Delta. So we're not sure that if it's more dangerous, but we certainly know it's more infectious. Currently in Alabama, we have an immunization rate of, me and Felicia were kind of debating. She looks at who had the first shot. I look at who's actually had the second shot. If you look at the second shot, we're probably clocking somewhere around 40–45%. That's statewide. 2 weeks ago, there was an article in the Advertiser that said the black belt was running like 28%. Wow. So we're still running behind in the black belt. I'm sure it's come up some, but it still lags behind what the state average is. And the state average was low enough, but the black belt is still running behind that. So we still have some work to do in trying to get some of our people of color out to get the vaccinations. And I'll be interested to see what some of you folks think of the reasons why we're having so much trouble vaccinating our own neighbors and Afro-Americans and people of color. So that'll be an interesting topic to talk about. In Alabama now, about 25% of infections are pediatric infections. As a rule, the pediatric people who have get COVID who are in the pediatric age group still have less symptoms. But we are starting to see more hospitalizations in the pediatric age group. We are starting to see more kids wind up in ICU. Over the past several weeks to month, we've seen that the pediatric ICUs have been full, although not to the same impact as the adult ICUs. But we do have that small percentage of kids who will end up in the ICU. Now, we also know that immunization-wise, it's only Pfizer is approved for 12 and up. So kids under 12 cannot get vaccinated. So the best way to protect kids under 12 is by getting as many of the adults in the 12 and up population vaccinated. And that way you can protect them because you've been vaccinated, you can be protected. In Montgomery, we've already had a couple of 3 schools closed because of COVID outbreaks. That's probably not a surprise. You know, you were probably going to see that continue as well, simply because you got kids 11 and under have not been vaccinated. They got masks on, although we don't have a full mask mandate. But you know, kids are going to play, they're going to socialize, and it's going to still be passed from child to child. And we also have a low vaccination rate in some of our communities of color here in Montgomery and in the Black Belt. So we're going to still see those infections. So we're going to probably still see the pediatric percentage rate continue to go up a little bit more over the next several weeks to months. As the adult population infection rate is going to start to come down. It's been said that the infection rate for in the state of Alabama, it seems to be plateauing. Our infection positivity rate has dropped from about 21-22%, which at the time, maybe 3 weeks ago, was the highest positivity rate in the country. Today we're at 19%. So 19% of the tests we do are positive. So that's coming down. So it looks like the infection is plateauing and maybe starting to come down. And it's probably not from herd immunity, but it's probably the fact that people are getting a little afraid, getting the vaccine, and probably being a little more careful with the mask and doing a little bit more restrictions in terms of what they're doing. You know, I think everybody talks about when they go back to the way things were normal. I'm not sure if that's going to ever happen, because I still think we have to be careful. When we talk about vaccines, one of the other things that we're hearing about now is breakthrough infection. And people are concerned, well, if I got the vaccine, why am I having a breakthrough infection? Well, one of the things that I've done as a pediatrician for 40 years is give them tons and tons and tons of immunizations. And from H-flu to diphtheria to pertussis to whooping cough, pneumococcal, the whole 9 yards. Most of those things that I've called are not as infectious as COVID. The only infection that we previously have vaccines for that was almost as infectious as COVID is the chickenpox vaccine. And you do have breakthrough infections in some of the vaccines that we do give children. I've seen breakthrough infections with chickenpox. Instead of having vesicles all over your body, they may have 5 or 6, but it's still chickenpox. So again, what the vaccine does is not fix it so you do not get the infection. Number one, it protects you from hospitalization, it protects you from having serious infection and death, but you still may be able to get infected. It's also believed that even with the vaccine, you're least likely to be as infectious as lung. In other words, you may get exposed to COVID, you may have COVID in your nasal pharynx for a day or two, but then it's gone because your antibodies take place. So again, that's another reason why that we want to get the vaccine. And we shouldn't be that worried about the breakthrough infections. We know that the vaccine, the average hospitalization for an infection, a breakthrough infection for adults is about 69 or 70 years of age. The average hospitalization rate for unimmunized patients is about 49 years of age. So it makes a difference when you do get the vaccine. So I think it's very important that we do try to encourage others to get the vaccine. I'd really be interested to hear what some of you guys have heard and ladies of why people are vaccine hesitant. And I know a lot of it's because it's become political, but at this point, we're about 18 months into the vaccine. We've been given several billion worldwide of this vaccine, and it's just as safe as some of the other vaccines that we have been given for 20, 30, 40 years. So the safety, is probably well documented at this point. So that should not be an issue. But it just seems that some people are reluctant to receive this vaccine for political reasons. But we know it saves lives, we know it prevents hospitalization, and it helps you protect your own family members. And I think all those things are key. Because I talk to parents, and we've been getting a lot of panic calls since school started about whether or not kids should go to school, whether or not should be exposed. And again, one of the best ways to protect a child is to get vaccinated yourself. I had a long conversation with a mother whose son was at high risk. And there are different risk factors even when we talk about pediatrics. We talk about obesity in childhood. Obesity is a major problem that we have in children now. 40 years ago, kids were undernourished. Now they're overnourished. Diabetes is a high risk, makes them a high risk. Severe asthma, all those make our kids at high risk for having those severe complications that I mentioned earlier. But this parent was calling me about whether or not she should get her child vaccinated. The child was 14, sure, he needs to get vaccinated. As we kept talking, she said, I think I'm going to do it. But her husband and her were not going to get vaccinated. So that really almost negated what she was thinking about doing for the child. The best way she could have protected her child initially was to get vaccinated, her and her husband to get vaccinated first. So those are kind of things we have to consider. And kids, a lot of times, they really don't have any symptoms, which is another problem that we have. And you can't really tell by the way they're acting or by what they're doing whether or not they have any symptoms. A lot of times, the runny nose or just a cough. And if it wasn't COVID, we say it's allergy, we say it's a URI. But then you test them and lo and behold, they're positive. They're positive, but they never stopped doing anything that they were doing. So it's important that we be aware that some kids, number one, are asymptomatic. Probably asymptomatic rate is probably about 20%. And sometimes the symptoms, although they may be very minor, they could still be tested positive for COVID. So those things we have to consider. The other problem that I'm seeing is that when we talk about quarantining, people don't quite understand what quarantine means. Okay, so your child is positive and so needs to be quarantined at home for 10 days. The schools go 10 to 14 days and they can't go back to school until they fever out for 24 to 36 hours and they have no symptoms. But that also means that since you live with that child, everybody else needs to be quarantined. We had a mother come into the office today, bringing a child in for a routine checkup, but she had another kid at home with COVID. Okay, and so we get a little bit twisted when we don't understand what true quarantine means. Quarantine means if you've been in contact with somebody that has COVID, all of you guys need to stay in the house. Not just the person who had the close contact, because you can't. The rules say you can't test out of COVID, so you have to quarantine for 7 to 10 days until that quarantine is up. Everyone should be quarantined. So that's a problem that we're having. People still going out with the mask, even though they're supposed to be quarantined. So it's important that we encourage people who have contact with someone who has COVID, who maybe live with someone who has COVID. I know it's an inconvenience, but if you live with someone who has tested positive for COVID, that means you're quarantined as well for the whole time that person is quarantined. It's important that we encourage patients to do that as well. I want to stop and we'll take questions now, and we can have conversations on why people don't want to get vaccinated, what some of the big causes of vaccine hesitancy. Any other questions on COVID that I might can answer for you guys?
Dr.
Yes,
Dr.
sir.
Holloway,
Yes, sir.
one of the questions that came to me was, what is the impact of the vaccine on fertilization, causing women to become sterile?
None. Straight up none.
Wow.
We encourage, since you mentioned that, some studies have been done and they encourage people, mothers who plan on getting pregnant or who are pregnant, to go ahead and get vaccinated. Okay, because again, that protects the baby. Okay, if the mother's vaccinated, she develops antibodies. So after the baby's born, she breastfeeds, that baby gets some of those antibodies, protects the baby. Now, I read about a 2-week-old baby that was in the pediatric ICU down in New Orleans with COVID, who was very critical. But if that mother had possibly gotten the vaccine and they're breastfed, the baby would have gotten some antibodies and had some protection. But it does not affect fertility at all. And again, when we think about this vaccine, this is a messenger RNA vaccine. It's different from any of the other vaccines that I've given kids, and most of us in here have got. Because usually the vaccines that we get, you take a piece of the bacteria and you make it weaker, you inject it and you get an immune response. What this does, you put a piece of the RA, which is the amino acid that kind of tells the cell what to do, into your system. It attaches to the cell and it tells the cell to make the little prongs that we've seen in all these pictures of COVID, and then our body attacks those prongs. Once the messenger RNA has done that job, it goes away. It's destroyed. So it doesn't even stay in the body. Yes, sir.
I have an issue with two people of my clients. I'm in the field of Jerry College, and they are still with me, and they will not, no circumstance, take the advice that I'm giving. So I'm at a dead end.
Well, we can't bet 100%. All we can do is give it our best shot. You know, I've been up to some, back earlier on in practice when I used to do neonatology, we used to have to do exchange transfusions. One of the biggest, an exchange transfusion happens when the baby gets so jaundiced, you got to take out some of the blood so the baby won't get injured. So basically, you take out the baby's blood and you put in some other blood so you get the bilirubin to come down. One of the biggest nightmares you want to have is for that baby to have a Jehovah's Witness parent. Because they will refuse that transfusion because they don't believe in blood transfusion. So we would have to actually literally go to court to do the exchange transfusion. So they're willing to let the baby die or be severely handicapped before they would do it. So some things we're not going to change. Now, one thing that I was reading an article that's saying that since our president has put forth this mandate that employees over 100 are going to have to either require their employees to have the vaccine or get tested, you're going to see a whole lot more religious exemptions. But again, the vaccine is not blood. It's not a blood product. It's not a blood product at all. Yes.
Dr. Holloway, I have two things. The first thing is when you were talking about the children, and if a child is infected with the COVID, how does the parent, I guess, take care of the child? I know you talked about being quarantined, but what safeguards are there to prevent you from catching it if the parent is not vaccinated?
If you got a child that's positive, the only thing that you can do if you're not vaccinated is wear a mask and wash your hands. Okay, and I've had those instances because I've had some parents who've not been vaccinated. The kids have COVID. So what I tell that parent is, number one, if the kid is older, that says 6, 7, 8, quarantine them in their room. Okay, but you're gonna have to take the parents gonna have to take the risk now. They made that decision, so the best they can do is wear a mask and put on gloves. Now I had a mother who's positive and she's got a 1-month-old. Okay, and so she doesn't have that option, so she's gonna have to run that risk.
What do you say to those people who want to, I guess, say they don't trust the vaccine? They say things such as the government is putting a chip inside of me, I don't trust it, I don't know what's in it. And what I've said to them is, when you was growing up, you didn't know what was in the chickenpox vaccine or these other vaccines when you went to school. And so now, as adults, they're fighting it, saying we don't trust the government, and a lot of times they bring up the Tuskegee spirit. Can I answer?
Okay, I guess a couple things. They mentioned that a lot of African Americans say they don't trust the government because of the Tuskegee spirit. Okay, which may be well and true. The problem we got now is that a lot of medical research, they don't involve enough of us in it in the first place. Okay, so that's a problem that we have right now. There was an article talking about the problem that we have with sickle cell. And the fact that you can have a bone marrow transplant, which is not the best thing to have. The best thing to have is the gene therapy. But there's not enough research being done that could actually help the patients who have sickle cell. Most patients who have sickle cell are African American or Greek. I had never treated a Greek with sickle cell. I've treated plenty of black folks with sickle cell. Now, so if you don't trust the government and you think that they're trying to do something to black folks, a whole lot of white folks getting the vaccine. Okay, number one. I'd be a little bit more skeptical if they would just bring it to the west side of Montgomery. You know, but they sedate it all over the place. And safety, it's over several billion of these vaccines have been given now. You know, so at some point, if you look at the data, then you need to change your mind. But some people that I've talked to, you can give them data on top of data, and it's not going to change it. They don't need to put a chip in you. You got a cell phone. You know, why waste your time to put a chip in you?
Or Alexa.
Yeah, you got a cell phone. And so all those things are just things that people have read and just picked it up and going to run with it. But, you know, there's logic to answer those questions, but a lot of times that logic doesn't win out. Yes, sir.
So I'm trying to understand, you have individuals who have people who are saying, well, now they come out with the third shot, what's next? With this, you know, this booster shot or whatever they, I mean, if we get this booster shot, then the government turn around and say you're gonna need another shot. So what is gonna stop or determine us from the government saying enough is enough?
Okay. They say, I guess we have to look at it two different ways. The government has a national crisis, so the government is involved. Okay. Those other vaccines that have been mandated have not been involved in a pandemic. So they did not have to come up with some kind of national solution for it. Now, we're talking about a virus. A virus mutates every year. That's why we get flu shots every year. You know, I have not seen the research, but I would be surprised if I don't have to get a coronavirus vaccine booster periodically. Simply because the virus is going to mutate, it's going to change. So it's just a matter of what it takes for us to remain safe, because coronavirus is not going anywhere. It's going to be here. And the virus is going to change. You know, there's already another mutation called mu, I think. Okay? So we don't know enough about that. For all we know, that may be more infectious than the one that we have now, but we just don't know. And so we really stepping on new territory. Another thing that with immunizations is that most of the people who are not in favor of vaccines now have not been around when we were dealing with diseases that were frightening people. Okay, you know, I'm old enough to remember in the summertime when my parents were reluctant to let us go to the swimming pool because that's when polio outbreak came about. And so polio was not a routine vaccination that you got at 2, 4, and 6 months when I was growing up. You know, when polio came out, I was about 7, 8 years old, and we lined up and outside on a Sunday and went through a school, and the public health people gave us a sugar cube to prevent polio. And there's some other diseases that we don't see anymore, and that I don't see anymore since I've been in practice, that people aren't aware of. You know, I don't see H2 meningitis, I don't see pneumococcal meningitis. Serious infections that patients got killed some, made others severely handicapped, but we don't see those things anymore. But we don't know enough about this virus to know what's it going to be like in 2 years or 18 months from now. So we may need another booster. And most of us have never been in a pandemic. The last pandemic was back, what, 1918? The flu pandemic. So we've never been in a pandemic. You know, so that's another thing that we have to take into consideration.
Dr. Holloway.
Yes, sir.
What would you say? I've heard reports that some of the parents, like in some of the school systems, like in Montgomery County and Talbot County, or some of these other counties, Elmore County, that the school officials, they're sending home notes to the parents, and it's a note that says that someone in the child's class, in the child's class has been has tested positive for COVID. And this note is just to inform you of it. What would you recommend, or what would you say to those individuals that may experience that in these various counties?
Okay. I think what's happening now is if there's someone that tests positive in your class, those parents will be notified, not the entire school. So if someone tests positive in the class, what we're recommending is that if the child has no symptoms, they just need to quarantine. The school, Montgomery, I think, is 10 to 14 days. But if they have symptoms, and the symptoms is kind of flexible now, because that means they got a runny nose, they got diarrhea, then we should test them. Okay? But if your child has been in a classroom with somebody tested positive, does not have any symptoms, then he just needs to quarantine. He doesn't need a COVID test.
Does the teacher need to quarantine of the rest of the students?
The teacher needs to quarantine as well. That whole class needs to quarantine. The whole class needs to quarantine.
You said something that's very interesting.
Yes.
2 minutes ago about a couple of viruses that we have not seen. Are those viruses laying dormant? But they haven't just disappeared, correct?
Okay, those the H flu and pneumococcal bacteria. They're not viruses. So they're still here, but the kids have been immunized, so they don't cause an infection. You still see them when I swab. Since I've been doing so many respiratory swabs for COVID, sometimes the report will come back and say negative for COVID, but positive H flu. But I don't need to do anything about that because the kids are immune, and if you come back positive H flu, we don't need to do anything. So those bacteria are still around. Chickenpox is still around. You'll still see occasional breakthrough of chickenpox. So they are still around. Now, as a practicing physician, and I finished med school back in '75, I've never seen measles. Okay, I had both of me as a child growing up, but I've never seen measles. And so measles is still around because you hear about outbreaks periodically. When it's an outbreak, it makes front page news. And I haven't seen any kids with mumps since the first couple of years I got to Alabama, which is a whole nother story because to me it was like third world medicine then.
Have they exactly pinpointed where this virus came from?
No, they have not. They have not. The initial thing when they felt it came from the wet market. If you go into China, and I saw something similar to that when I was visiting Africa one time, they have all different kinds of wild live animals you can buy because the Chinese believe that certain wild animals have certain properties, and if they could just cross over. Now I was reading an interesting article a while back, and they were saying that we're going to continue to see these kind of outbreaks, even because of the way we do farming now. Because of the way we can bunch animals together. We have all the different waste and everything just pouring out and how it's disposed, that we may see other outbreaks because of the way we do mass farming now. Because I'm not a farmer, I'm a city boy, but I think what will happen a lot of times, like with hogs, they just have hogs lined up in a row, and the excrement just goes down into a pit and goes out. And so they're saying that we may see outbreaks because of those, the way we do farming there as well. Yes.
Question. The monoclonal antibody treatments that are out now, I know that I think they've had stricter restrictions, or there's some restrictions on who can get that now. It used to be a time where if you tested positive for COVID, you could go on and get the monoclonal treatment. Now it's I think it's underlying conditions, and you have all this other stuff in addition to testing positive for
criteria for adults, and for pediatrics, it's 12 and up, over 40 pounds, sick less than 7 days, and have high risk factors for diabetes, cardiovascular issues, obesity. You know, that would determine that. But I think even more so than that, the thing that's going to determine it is your good old Blue Cross Blue Shield and Medicare. You ain't gonna pay for all that expensive stuff.
It's
But all
the
you
same
need to do
requirements,
is get the
though.
vaccine.
It's definitely the same.
Yeah, so
Because-
that's what's
yeah.
gonna happen with that.
Okay.
Because if you know, even from the start when we were able to get the monoclonal, those criteria have been tightened down. You know, now I got pediatric criteria. So just because your baby tests, I can't see you only get it now. And now Blue Cross will be Shield and Medicaid gonna start denying them, and so that's gonna cut all of that out.
So if they can't get it, they might go and get the shot anyway? Or do you think that that's something that has, you know, been a factor in people getting the vaccine?
I don't think being able to get the monoclonal antibodies has been a factor, really.
Okay,
I don't think so.
okay.
It may, as that become more of a big topic, because I had a couple of moms call me asking what their children eligible for. They wanted to get it to keep them from getting it.
Oh.
You know, but I don't think up until now it hasn't been a big issue as to why.
Okay.
In terms of vaccine for kids under 12, it's still up in the air. They're still doing the studies. The guesstimate is that it won't be before winter or spring before we have any vaccine approval for kids under 12. Because it's a lot more complicated, because the 12 and up group, they didn't change the dose. So the 12 to 16, 17 age group got the same dose as the adults. For smaller kids, for infants, you gotta figure out what the appropriate dose is. So it's a little more complicated, a little more hoops you gotta jump through to figure out how to immunize the younger kids.
Dr. Holloway, I know this may seem far-fetched, but I had people that ask me, can pets catch COVID?
I seen an article where they said some dogs and cats have had COVID. Yeah, they can get it. I'm not a pet person, so but yeah, animals can get it. Ivermectin is not documented to prevent or treat COVID. It's for parasites, right? It's for parasites. Any other questions? Any other comments?
Comment. Just to piggyback off of what you said and what you said, I was people. I was a conspiracy theorist person of, I have my own reasons why I don't want COVID. I have done the vaccine, I have done my research. But with me being on both sides of the fence, when it first came out, I had COVID before they had the medicine for it to prevent it. And I can honestly say, during that time and me catching COVID the second week of this past August, the difference I was partially vaccinated when I caught it. I caught it from one of my clients that I had. And the difference, it's definitely a difference as far as in the healing and the symptoms, because the first time I had severe symptoms and I had it for exactly 14 days. This time I had milder symptoms, and it was probably maybe around the 7th day that the symptoms, the kind of hard symptoms were, as far as diarrhea and runny nose, loss of taste, fevers and stuff like that. Around the 8th day, the 8th through the 14th day, the only thing that bothered me was still a lack of energy. And I'm not even gonna say it was still something left over from the virus, but as we know, when your body is sitting still, you're losing energy because you're not moving the way you used to move it. So now when you start to get some normalcy back into your life, it's gonna be a little challenging. But I did not want that shot. I have both shots, and I'm gonna tell you, I still have my reservations about it. However, I have a brother that lives with me, and he has severe asthma. I'm a nurse. I deal with clients. I deal with a lot of elderly. So my decision was more for the safety of others. Sometimes we gotta step outside ourselves, especially when it comes to your relatives or whatever your profession is. Then I also looked at it as, this is gonna wind up becoming mandatory. Like you said, this is the new norm. This is the new norm. We have to get used to it. So the thing about that is, they say it's not mandatory when it first come out, but they don't say, well, hey, it's not mandatory, unless you want to travel out the country, go to big events, keep your job. So at some point in time, you're going to wind up having to get vaccinated, or you're not going to be able to have any normalcy. You're just not. You're not. So when I got the first shot, I think for 2 days I had like a light headache, a little dizziness, a little nausea, and I'm like, oh God. Then after that, I caught the COVID. After the second shot, I was fine. So to me, being on both sides of the fence, I feel like it does make a difference as far as minimizing the symptoms. It did prevent me from going to the hospital. So I would ask that the people, i.e. the same person I was, if that's how you feel, sometimes it's not about you. Sometimes you have to be courteous to your family, your children, your neighbor. Everything is not about you. And let's be honest, as people, especially when it comes to politics, I think some of the main thing is you're telling us what to do, and people do not like to be told what to do. They want to be a struggle, a fight towards it. But what does that fight cause you? Is it going to cause the loss of this person, this person? I have several people I've lost from COVID. Several. So that was another determinant for me getting a vaccination. So sometimes you got to think outside yourself. You have to. I mean, that's what made me get it. And I sat right there and I cried. She said, why do you cry? I said, because I really strongly feel against this. Well, why are you sitting here? I really feel a little stronger for the people that surrounded me and the people that I work with. I infect one person, they infect one person and one person and one person. Before you know it's 100 people infected. How many people have died from it? Is that worth it? Do I want that on my conscience? No, I do not. So I am people. But again, I understand why I'm vaccinated. And I'm not upset that I didn't do it. That I did it. I'm not. I'm just not. I think it made a big difference as far as when I first had COVID versus this past month when I had COVID. I seen the difference. So sometimes people got to walk the fence, and a lot of people don't understand. My analogy is people don't understand until it's you. You don't get it. Everybody's, I'm gonna still go in the crowd as long as I do this. You're not understanding until it's your grandmother you're burying. It's your cousin. It's your sister. You do not get it until it's you. But why, excuse my French, in the hell should we wait till it's you? Why would you even put yourself on the line, or your family on the line, or your co-workers, or your community? Why would you do that? That's so I just wanted to put my sense into it, because I done been that person versus this person now. So I get it. I just wanted to share a little insight, because it's getting ridiculous. If you're not going to do it for yourself, do it for the others in your community.
You made some good points, because one thing that you need to think about, if we had a much higher vaccination rate than what we had this August or July, you would not have so many pediatric problems that we have now. We've hurt so many children because we as adults didn't get vaccinated. Okay, because the adults that got vaccinated would have been the least chance of somebody else passing the infection on to the children. So we've hurt a lot of kids because we politicize whether or not we need to get vaccination. Even to get the vaccination, you still got to be smart. You still need to wear a mask. I have some folks that I test periodically because they travel to go see their grandchildren. And so they were getting ready to go back and visit the grandchildren, so they're getting ready to have a new one. And so we did a routine test. They've been vaccinated, they had no symptoms. Guess what? He turned up positive. Okay? So you still need to wear your mask. You still need to avoid all these big crowds and those kind of things. You got to take all those things into consideration. This summer when we had two of our grandchildren, I was going to take them over to see my dad, their great-grandfather, but we had the girls in daycare. So by midweek, they started having cough, runny nose. Guess what? You got the Zoom call them. I ain't taking them over there. Okay, because that runny nose they have might be COVID. Now my dad's been vaccinated, I've been vaccinated, but we don't want to take that risk. So you still got to be smart with what you do and how you come in contact with people.
Can I make an observation right quick? Just piggyback off what this young lady here was saying. When my mom she caught the cold in Birmingham. And it hurt me to my heart because then I'm only child. When I went from here to Birmingham, then I couldn't even go in the house. And it hurt me so bad. I had to go to the store, leave the stuff outside, go to my aunt's house, and give it like 5 days. Because, you know, it's only just her and I. Yeah. And it hurt me that I couldn't go inside the house that I grew up in. And 5 days after that, that's when I got my test. So I tell anybody, it hurts. It hurts to know that I could not go in there and hug my mom, physically take care of her without kissing, which I wanted to so bad. But I got a family of my own, and I had to think about it. So I'm gonna leave with what she's saying. That hurts.
It can be tough decisions because my daughter who lives in Texas, I lose track of age, but she's probably about 43, 44. She caught COVID, healthy, former college athlete, still lifting weights and stuff.
Wow. Talking
On the phone to her one Saturday, of course, I'm sending nebulizers out to Texas and all that. But she's having trouble breathing. She gets diagnosed that Monday. So I'm sitting here in Montgomery. What am I going to do? If I fly out there, they're not going to let me see her. I have to go to jail because I'm going to have to go in the hospital and cut up. You know, let's face it. You know, so you're in that corner right there. There's nothing nothing I can do for my child. You know, if I go out there, they're not going to let me see her. Then my wife, and if they don't put her in the hospital, if you go in the house, that means you had to stay out there for 2 weeks. So it's a tough decision. And the other thing is we go through this thing, there's so many black folks have suffered a loss. You know, I talked to one family, one kid, and in that family they had lost 4 people in their family. You know, and so we got to be also as providers, you know, and as caregivers, aware of the fact that so many of us, as our family and our neighbors, have suffered loss. You know, we've all lost. I've lost an aunt. I've lost a guy, my art dealer, and a couple other friends to COVID. Any other thoughts? Any other comments? Yes, sir. Ma'am, I can't see that far. Go ahead. I'm sorry.
So what's the difference between just having COVID and being vaccinated? Like, what's the difference between being vaccinated and having COVID and just being not vaccinated and having COVID?
Life and death. Okay.
Wow. Wow, that's strong.
Wow. I think when I first mentioned that if you've not been vaccinated, you probably got a 30% higher risk of being hospitalized, and you got about a 12 or 13% higher risk of dying. Okay, about 90% of people in the hospital now with COVID had not been vaccinated. Okay, so you're putting yourself at a risk, and COVID does kill young folks. In your 20s, and you know, because we've had pediatric patients who have died. It's rare, but if it's my child, then that's 100%. And so it's a way that you're trying to protect yourself from the possible complications of the disease. Okay, we don't have any documented deaths from COVID vaccine, but we got plenty of documented deaths from the COVID infection.
Yeah.
Did he answer your question?
I understand what you're saying.
Okay.
Okay, I have another question.
Sure.
What if you're vaccinated, if you're vaccinated, there are no chances of you being hospitalized or no chances of you dying or giving up to anybody else?
Okay. One thing you don't know about medicine, nothing is medicine 100%, okay? nothing that we do is 100%. I didn't say that. I said that your chance of being hospitalized is much, much, much less. And if you do go in the hospital, then you're probably not going to be as sick. Your chance of dying is much, 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 much less. Okay? There's nothing 100%. But again, the people who have been hospitalized, who've been vaccinated in the 69 and 70-year-old range, but people unvaccinated in the 40-year-old range. So there is a small chance, but it's much, much smaller and less likely that that will happen.
I just need you to please reiterate. Please reiterate. Because it's a myth that, oh, if I got my vaccinations, I'm not going to get COVID. Could you please educate people? Because that right there is one of the biggest myths. That, and it's for older people.
Okay. There are breakthrough infections. Okay. You have breakthrough infections with the flu. I see breakthrough infections with chickenpox. Okay. So, but the disease is much less. When you get a flu shot, that doesn't mean you. And so there are instances where there are some breakthrough infections if you've had the shot. Okay. As I told you about a friend of mine, he'd been vaccinated. He tested positive for COVID. He didn't have no symptoms at all. If we hadn't tested him because he's getting ready to go see the birth of his new grandbaby, he wouldn't even known he was positive. You know, so there are instances of breakthroughs, but they usually don't put you in the hospital. They usually don't make you real sick. And you have very few symptoms.
Dr. Holloway,
Yes.
can you elaborate on, as far as recommendation, what should people do in terms of like diet and things like that to kind of help combat the COVID virus? Things that they can do in terms of like vitamins and things of that nature.
Okay. I'm going off label. It ain't in the textbook, okay?
Oh.
Okay, so if I come out my pediatric book and I go to my my nutrition book, you know, that means you would do elderberry, you would do zinc, you would do vitamin C. Okay? I'm taking elderberry, zinc, and vitamin C. Okay? But I got the shot too. So those are, of course, the energy and nutrition is fine, you know. And, you know, we can't reduce any other risk factors at this point because I can't do 40 pounds in a month to make that risk factor go away. But, you know, healthy diet, vitamin C, zinc, and elderberry, what those things are saying. Anything else? Any other comments?
Okay, thank you so much. We'll call you for the next one.
Oh, Lord.
You gonna say that? We'll give you
You
some
didn't tell me
time.
how she caught me with this one. I hadn't seen her since Medicaid. And so I was doing a talk on COVID at Children's Rehab Service. She happened to be on the line. The next thing I know, she come calling my wife.
We know how to get to the husband. All right, that's right. Well, thank you so much again. And I want to, I would be remiss if I did not bring up Avery Brown, who is the bacillus for Omega Iota chapter. And of course, this is their event. We're just partners. So I want Avery to just address the crowd as we close out.
Okay. First and foremost, I want to say thank you for everyone that came out today, especially thank Alabama Department of Public Health, Alicia Farrow and her staff and team, Dr. Holloway, Pastor Sales, Brother Chris Johns, Bridge Builder Counseling. Thank you so much for sponsoring, and of course, Green's Wings for having us here today. This is hopefully the first of many that we'll have. And also want to thank the chapter Omega Iota for participating today, as well as Gumptown Magazine. Brother Jamal, we thank you so much for coming as well. COVID is something that's very, very serious in our communities. We must take it serious, and there's more that we have to do as a people. And so get vaccinated, spread the word, let's get it out there. Let's dispel these different myths. Let's make sure we get vaccinated and do the things that we need to do to make us a safer community. And so once again, thank you for coming out. Really appreciate you, and Godspeed. Thank you.
Okay, everybody, there are some wings and some beverages over here to my left, so please partake in those things. And of course, there's some information over here, hand sanitizer. Please get some, take it with you. And any of the information here, we got a mask here. You know, we need to change those out too. Don't wear the same one every day.
Thank you.
So,
People think that. People really think that. Thank you.
I'm guilty.
So change out your mask. We got some right here. We got some. So thank you again to Leslie for bringing all these items for us. And with that, I bid you good night. Thank you so much.
Can I say one?
Oh, sure.
Listen up, everyone. Brother Chris John and myself was having a conversation, and I want to leave you all with this right here. The information that was given tonight is digestible. Once we digest it, we take it in. Once we take it in, we go out and regurgitate it. What I mean by regurgitate, we spit it out to the next people. We got to get it out here. This brother did not have to come out here and do what he did. So we need to thank him by doing what we supposed to do and go out there and spread the word.
That's good.
All right, Gumptown, thank y'all for logging in into this Chat and Shoot hosted by Omega Psi Phi Fraternity. Please share this video with your friends and your family members, and let's get vaccinated. Gumptown, be everywhere.